All the eyes, of course, on that superbug sweeping the globe, the swine flu, a public health emergency that's killed more than 100 people already in Mexico, jumping international borders at lightning speed. For more on what you need to know and need to do to protect yourself and your family, we're so glad to be joined by Oprah Show health expert, Dr. Mehmet Oz. Thank you, Dr. Oz, for being here. Again, put it into perspective for us, because, you know, we hear the CDC says that we hear the word emergency. Right. And, of course, our first reaction is, okay, what's going on here?
That's a very normal response. We're humans. Someone says emergency, you jump back. Dr. Besser is actually a classmate of mine from medical school. So I had the opportunity to talk with him last night, and I really think what we're hearing publicly is what they think privately. And although we use the word emergency because it's the same code we use to get people out of hurricane paths, so you want people to act, this is a little different in its urgency level, and we're really not going to know for sure what's going on for another week or so. So the key point for today's show, I think, is to give you some ideas of what's happening, put it in perspective so you know what to do today, and what you might be able to expect over the next few days.
Let's go over the symptoms again.
It's a flu. Like any other flu, you're going to get a fever, 100.5 being sort of the threshold for what defines a fever. You're going to get muscle pains. Those are two classic symptoms you'll see. You might get some sneezing, some runny nose, some dry cough. You might get some vomiting and diarrhea, but look for the fever and for the muscle pain like you would for any other flu. Especially be attentive if you've had some exposure to the swine flu, in which case you really want to call your doc and at least get tested to see if you do have this ailment.
People hear swine flu, swine they hear, and they're like, pig. Okay, does this mean if I eat poorly cooked pork or
properly prepared pork is just fine, no issues at all. The real danger is because this virus morphed and mutated together with a human virus, so now it can pass from human to human. That's why it becomes dangerous.
And so I see that you have some of your products that we always should be able to have on hand, be able to prevent it.
Across the board, people are concerned about how to prevent themselves from getting this illness. So if you think you may have the virus, please stay at home. That's a pretty action step. Keep the kids at home as well. And in addition, you always want to be wise about how you behave towards people around you who you may not know their health benefit. This happens to be a tool that we find extremely useful within communities. We give them to all of our transplant patients because it's an alcohol hand sanitizer, which means it's easy to carry. You can have little packets that can do it as well. And these little packets you can pull out of your pocket. If you shake someone's hand and you're not sure, you can wipe them off. But you ought to avoid kissing, avoid hugging.
Really? Yeah. You know, all that?
All that for the next couple of days so we know what's happening. Because we're going to be able to figure out, based on what happens in Mexico, what's probably going to happen in this country. Masks might make sense for some people.
Why do we see it in Mexico? You see them wearing the mask, but here it's not a requirement.
The virus is primarily passed by people touching people. Now, a sneeze travels 100 miles an hour. So if you're going to move, you got to move quickly. So you're going to have to wear the mask all day long. People generally don't wear masks. By the way, don't waste money on very expensive masks. They've been compared to these inexpensive ones. If you're going to wear a mask, save the money. But I actually think the most important technique is to use a hand sanitizer. Cover your nose if you do sneeze. All the things your mother told you to do will also be effective today. And if you're sneezing a lot, don't get around other people. Do them a favor.
Go upstairs or go wherever you are. Just leave yourself. Be by yourself.
You can quarantine yourself as well. By the way, one big action step for America to recognize is you ought to be planning for what would happen if tomorrow we come on the show and say, don't send your kids to school and don't go to work yourself. So figure out, how am I going to work at home and how am I going to do with my kids? How am I going to take care of them if I've got to go to work and they can't go to school because of an issue with swine flu?
What about traveling around? Air travel in particular?
Well, the CDC and World Health Organizations are both saying you can travel to Mexico, but I'll be very frank. I mean, the Oz children, my kids, are going to school today, but they're not going to be allowed to go to Mexico, especially to one of the provinces where there's a swine flu outbreak. So I think that's just rational advice I would tell my own family. However, other air travel I think is perfectly fine. I have no concerns about that whatsoever.
So use common sense as you would with any kind of illness, flu or anything like that.
And stay away from other people. Learn how to isolate yourself a little bit. And the key days to pay attention to this news are the next 5 days. We're going to see a quick step up in the incidence of flu in Mexico, or it's going to die out. And so whichever way we go, we're going to want to be able to respond.
All right, Dr. Oz, I'd normally hug you or shake your hand right now, but I'm going to take doctor's advice right now. Stay downwind.
Here, I'll sneeze on you.
No, but thank you. But these are all things that people should, and I'm glad that we're doing this, because when you heard it over the weekend, you really didn't know how to react or what you should be doing.
Well,
so this really,
public health officials are appropriately worried. There have been tens of millions of people killed by huge pandemics in the past. We don't know if this is one. Let's figure it out.